somebody from the wellness committee to do an introduction, but there's not. So I'll do it. Okay, I'm Ann Lipscomb. I'm one of the nurse practitioners in the wellness clinic. And I know in the past, when Debbie Pearson did our introduction, she had this great presentation, or this great trick that she told a fun fact about each one of the three of us, about Ann, Kathy, and Lisa. And she didn't tell who it belonged to at the beginning. She just told you the fun facts. And then at the beginning, you get to vote about who does the fun fact belong to. And we'll see what you guys think. So there's one of us up here today whose hero was Julia Childs. Okay, that's one person. There's another person up here who was in a big band in an earlier life. And then there's another person up here who used to do triathlons. Okay, so think about that as we're talking. Lisa has kind of lost her voice, and she's new also, so we're not going to make her talk, but she'll be in the slideshow. So. All right. What's that? Well, she's gonna stand up, and you'll see her, and there'll be a picture of her, and she'll be around so you can be introduced to her. Yeah. Here she is. This is Lisa Bouillon. She is the nurse practitioner that mainly works over in the Carlisle and the Arbor. Thank you. Okay. So I wanted to start out with a nice summer slide. And for those of you that didn't grow up here or haven't lived here very long, that's Barton Springs. Very cold, but a wonderful place to go. And I think we'll hold questions till the end. There'll be a time at the end for questions. And I know that there wasn't enough handouts for everyone. I'm pleased about that, but I'm sorry about that. If you would like to have a handout and you didn't get one, they will be available down at the wellness clinic in the waiting room of the wellness clinic later today and through the rest of the week. So you can drop by and get a copy if you'd like one. But this is also being recorded and it'll be on the portal, so you can listen again. All right. So this is a presentation about the wellness clinic and about the services we have and how we work. And we do this presentation once a year, so you'll hear it again if you come back again. All right, so we're going to talk about, like I said, the services that we've got. We're going to talk about nurse practitioners. They're also these days known as Advanced Practice Registered Nurses, APRNs. So for some reason, NP wasn't good enough, and now you'll start to see APRN. And we're also going to talk about chronic care management. This is a program that the clinic is participating in through Medicare that is available, and we'll give some information about that. We're also going to talk about annual wellness visits. There's another program that Medicare offers that we participate in through the clinic. So the large bulk of our services are acute care problems. So something comes up that wasn't that way yesterday, and you can call in and make an appointment to be seen, evaluated, and treated. Things like you get a cold, you're not sure if it's allergies or flu or COVID. We've got rapid testing in the clinic for both flu and COVID. We don't have rapid strep throat testing. I know that's come up a couple of times in the past year, but we don't have that. But we are able to the best of our ability, to distinguish between colds and COVID and flu with a rapid test. We also see a lot of people that have bumped into the furniture or the door jamb, or they've fallen and they've got a skin tear. So as we get older, our skin just gets less and less resilient. And skin tears are a big deal, so we do a lot of wound care. We also see people that are suffering from some kind of back pain or muscle pain or joint pain. Those are common acute conditions. Also, stomach kinds of things. Nausea, vomiting, diarrhea, constipation. We can help you with those things. So the more less common things, maybe you're short of breath. You notice that when you're walking down the corridor, you can't get as far down the corridor without feeling breathless. Or you don't get as far until you need to sit down and rest for a few minutes. Or if you get dizzy, oh, that's a common one. Or you start to see that your legs, your ankles, your feet, your lower legs are swelling up. Or if you're just suffering from what we're able to call malaise, where you just don't feel right, you just don't feel well. We also see people for chronic conditions, things like high blood pressure, asthma, or chronic obstructive pulmonary disease, heart problems like atrial fibrillation or congestive heart failure, other kinds of heart problems you're being treated for, diabetes. We also see people for arthritis. One of the other things that we do in the clinic that's very important, because we're usually different than, you usually have other doctors, and that's important for everybody to stay on the same page. But some of the other services that we can offer in the clinic are we can refer you to therapy. There's a therapy practice here in Westminster. It's called Select Rehab, and they offer physical, occupational, and speech therapy. Medicare and most insurances require that in order to be referred or in order to be seen by those therapists, you have to first be seen by a healthcare provider and get a referral. So if you're thinking, my knee is really aching and I'd like to go see the physical therapist, call us, make an appointment for an evaluation, and then we can write the referral. We also can help with referrals to specialty kinds of healthcare, like a dermatologist, or an orthopedist for bone and joint pain, or pain management. So we can help you find those other connections. And then we can also write orders for home health care. If you are under the weather for whatever reason, you've maybe just had a surgery, or you were ill and in the hospital for a while, and you've come back to your apartment, but you need some extra help for a period of time, we can connect you with the home health organization. So that's something that the nurse practitioners can do. Continuity of care, big deal in healthcare now. And basically it just means carrying the information from place to place. So if you're in the hospital, you want your primary care physician to know what's going on, what's happened, what they did in the hospital. Then if you see the people, the nurse practitioners in the clinic, you'd like your cardiologist to know what happened in the clinic. So we do a lot of communication. So that means following up after a hospital stay. We'll come to see you. Either we'll see you in your apartment if needed, or you can come to the clinic and we just go over everything that happened, make sure you've got everything you need. We follow up with you after you return from either home health care or from the Arbor. So if somebody stays for a while over in the Arbor and then goes back to their independent living apartment, we like to see you. If you go into the emergency room for something and you get back even the same day, we like to see you pretty soon after that to make sure what happened, how are you doing, do we need to do anything to help out. Like I said, we do a lot of communication with your other providers and try to keep track from them about what they're doing so we're on top of what's going on with you. A few more services we offer. We do ear cleaning. That's a scheduled appointment. We see a lot of people to clean their ears. We do lab work. We can do the lab work that your other doctors or nurse practitioners are asking for. We need an order. We need an order either faxed to us or a written order that you can carry to us so we know what is the test and why are you doing it. And then we draw the blood, but we send the results to your doctor. And we can get you a copy as well. We also do EKGs. We can order x-rays that come to your apartment, ultrasounds that come to your apartment. We can order MRIs or CT scans. Also, those are done outside at a radiology practice. We write prescriptions. We can refill your prescriptions if you're having trouble getting refills through your other doctors. We do injections also. We do a lot of B12 injections. We can inject some diabetes meds, some meds to control rheumatoid arthritis or psoriasis. We do allergy shots. And we also give testosterone shots. So that's something that you can make appointments for if needed. The clinic here also organizes an annual flu shot clinic. So that is posted and the information goes out around September, around about there. We also give other vaccines. We give pneumonia vaccines, shingles vaccines. We at the clinic order our vaccines through Terrytown Pharmacy. And so we're able to check on if you want a pneumonia vaccine, then we can find out how much that cost would be to you. And we can help you compare where's the best place to get this shot. So, all right. I'm gonna pass it over to Kathy.
Okay. Is that the last one?
That's the last one,
I can't see. So I guess she put Lisa in the middle. Lisa is our newest addition to Westminster Nurse Practitioner. She's been here since like December, right? Yeah, she was hired mostly to work over in the Arbor and do assisted living. So she does the long-term care, she does skilled rehab, and then she also does all the levels of care in assisted living. So I'll let her say what she wants to say about her history. But we're really happy to have Lisa here, and y'all would only see her if you go over to one of those levels of care. But sometime when you go to the hospital, if you have an injury, you're sick, and you have to go over to rehab for a little while, then you would get to know Lisa while you're over there until you're able to come back home. Do you want to say something now, or you want to wait till the end?
I'll wait.
Okay, we'll do that at the end. Okay, so just more information about nurse practitioners. Most of you have probably run into them by now. There's a lot of nurse practitioners and physician's assistants. They're very similar. They do very similar things. The main difference about nurse practitioner versus physician assistant is nurse practitioners were usually registered nurses first. So we registered nurse as part of our training. After the registered nurse, we go back and get advanced training in a specialty. Like I'm family nurse practitioner, so is Leanne, and Lisa is adult nurse practitioner. You can get geriatric, you can get cardiology. There's different specialties you can get. We collaborate with physicians. We are able to write prescriptions, order tests, diagnose and treat illness. So we can do most of the things that your physician can do. We all have state licenses and national certification, and we have to do continuing education in order to maintain our licenses. So how do we work? We kind of do the same thing as when you go to your doctor's office. We get a history, we'll do an exam, and then we'll find a diagnosis and decide what our treatment is. We communicate with other providers. Mostly we see people in the clinic. We will come to your apartment if you're not able to get down to the clinic because you're either too sick or we're worried you're contagious or you just can't walk down or whatever. We will come and see you in your apartment. It says we do telemedicine. That was more during COVID. We don't do very much of that anymore. We do have the chronic care management program, which is more phone-based. We'll go over that when I get to that. We do a lot of follow-up care. So if you come in and you're sick, we may have you come back in a week just to make sure you're doing better. We try to do as many appointments as we can, but if you walk into the clinic and you're bleeding or you're dizzy or something crazy like that, we will do our best to work you in. So we have a program called Chronic Care Management. This is a Medicare program, so it's covered by Medicare or your Medicare Advantage plan. It is a program that concentrates on care coordination. I'm just going to read it. The Medicare Chronic Care Management Program is a care coordination service covered under Medicare Part B. It's designed to help Medicare beneficiaries manage multiple long-term health conditions. It reimburses healthcare providers for providing dedicated support and management activities outside of a face-to-face office visit. So what that means is we may see you in the office, but we may call you 10 times afterwards just to see how you're doing, order medications, make adjustments. We didn't used to be able to get paid for any of that outside of the office care that we provide, and now they have a way for us to get reimbursed for that. And it gives better care for you as well. It has a 24-hour phone number that you can call in case you're having issues after hours. So services include increased communication with patient, family, other providers for care coordination. So even your families can call the number. I have family members call all the time. It's medication and condition teaching, provides patient with accessibility 24/7 to a provider. We develop a care plan for chronic conditions that are being addressed, and sometimes we'll add to it as things come up and new things present themselves, so we'll add to your care plan. We try to give you things to look for so you know when to call. And it's updated as needed and shared with the patient. The benefits of being in this program is increased communication between you and your medical provider. So like one of us is like your primary person, but whoever's on call may end up talking to you. We all have access to your medical records, and then we also communicate with any of your outside providers. It also involves you in your care by better understanding your condition and how to stay healthy. Like I said, it's 24/7 access to medical care by phone. During clinic hours, you still call the clinic. The number that we give you for chronic care management is for after hours, like after we leave at 5 and weekends. You can even call at 3 in the morning if you need to. One of our goals is to avoid the hospital if possible by identifying issues sooner and addressing them. So if it's Saturday afternoon and you're not feeling well and we're able to do something over the phone on Saturday that keeps you stable and prevents you from having to go to the emergency room, we try to do that. Identify and resolve possible problems early with more frequent contact. So one thing that wasn't on that last slide, we've been trying to call people on a weekly basis just to check in, just to see how everything is going. You know, sometimes you'd be like, I'm fine, I don't need anything, thank you for calling, goodbye. And that's all the call is. Other times you say, well, actually, I've been kind of noticing this, and that might trigger us to go and see you and do a visit, or have the nurse practitioner call you if it's our medical assistant calling you, so that we can address anything that might be happening. So the other thing we do, also another Medicare thing, you may have done this at your doctor, you may not. Some practices are very good about doing this, and some practices don't really do this very much. It's called a Medicare Annual Wellness Visit. It focuses on maintaining health and preventing illness and injury by assessing your risk and recommending interventions. So this is not the physical part where they go and they have you get dressed and listen to your heart and lungs, and you do all your exams. This is just mostly asking questions, make sure you're getting all your screenings are up to date, make sure all your vaccines are up to date, make sure you're doing all your follow-up that you're supposed to do. Medical problems are usually not addressed specifically at this visit, and so if you come in to do your annual wellness visit, we go over everything and you're like, oh, but by the way, my right hip is hurting, we're going to schedule another visit to address your right hip. This is just to go over all your chronic conditions and just get a big picture of everything to try to make sure that you're getting everything that you need. This will require answering a medical history and a health habits questionnaire prior to the visit, so you have a little bit of homework before you come. And this makes the visit faster when you get there. We'll just kind of look over that really quick. If there's anything we feel like needs to be addressed, we'll address it during the appointment. It does not include a physical exam except for vital signs. This visit is covered by Medicare once a year. There's no copay, no co-insurance or deductible required. If there's an urgent medical problem is identified during this visit, not like my hip hurts, come back tomorrow, like, you're short of breath and you're walking down the clinic for this visit and you have to stop 8 times. If there's something like that that's urgent, we will still see you, but it will be like a separate, like we do 2 visits at the same time kind of thing. Now, if it's really urgent, we won't even do the annual wellness visit. We'll just address the acute issue and postpone the annual wellness visit. But it could be something that's billed separately if it's not something we have to just stop everything and address. This may have been done by your PCP, unless you have an in-house PCP. Neither of our in-house PCPs do these annual wellness visits because it is at least an hour visit, and it's a lot of questions, and they unfortunately just don't have a lot of time to do that, so they've left it to us to do these visits. So if you have Pellegrini or Kroll, they haven't done these, and you probably haven't had one, and you are eligible to get one through Medicare if you would like to do that. It can only be billed to Medicare once every 365 days, so if you have one and you try to do it in 364 days, Medicare will deny it. It has to be a year or more. And you can call the clinic. The clinic can contact your PCP to see if you've had one. So if you don't have Pellegrini or Kroll, and then you go to see somebody over at ARC, we can call and see if you've had one, so that you don't end up getting denied by Medicare because you've already had one. So what do you do if you're interested in having an annual wellness visit? You can call the clinic. Sometimes we have a waiting list because we'll have 10 people that want to do them, and because they're long visits, we have to kind of schedule them, at a certain time of the week. It says we'll start making these appointments soon, so if you are interested, we'll put your name down, and then when we're going to schedule them, we'll call you and make a time for you. We were working last year on setting up the EHR. I think we've got most of it. We probably have to review it a little bit and make sure, because we have a new medical assistant who's going to be helping us with this, and she needs a little training still. But if you're interested and we get enough people signing up, we'll get on it and get it done so that you can get these visits done. All right, is there any questions? Oh, should we have Lisa? Let's have Lisa first, and then I'll do questions. You might want to leave her out.
Like she said, my name is Lisa. I'm new here, but I'm not a new nurse practitioner. I've been a nurse practitioner for about 10 years. I am an adult gerontology nurse practitioner. This is you guys are my people. I'm on my 6th month here. I know a few of you, and obviously I know a lot of the residents that are in my areas. And if you guys have any questions about assisted living or the Arbor, I'll hang around for a little bit, and you guys feel free to ask any questions. You guys have any questions about it now? Anything you think of? Okay. All right. I'd love to meet all of you individually, and hopefully I will, and get to know you a little bit better. My background, I was in cardiology for a very long time, and then when I became a nurse, I was a critical care nurse. And my almost entire 10 years as a nurse practitioner, I've been in primary care. So very used to chronic disease management and acute visits and all of the things that we've talked about today. So nice to meet you guys, everyone.
Do you want me to take this back to her? Well, I'm going to give it to him. Any other questions? Oh, okay.
I'll give him this one.
Oh, you're going to give him that one?
Yeah, I've got another microphone that we can use so everybody can hear when you're asking a question.
So just on the annual Medicare wellness visit,
Mm-hmm.
you said it doesn't include a physical exam, does it include lab work?
No, but we can schedule it if we feel that, if you say, I haven't had lab done for 5 years, we could schedule it based on what we find out at the annual wellness visit. So we might say, why don't you come back, tomorrow morning, get your fasting lab work done. We won't do it at the visit itself, but we can schedule it.
Okay,
If
it's
you need
it's a judgment call on your part.
Right.
Is it covered by Medicare?
I mean, if you come in to get lab work, unless you say, I just want to check this and this, and we say, well, you don't really have a good diagnosis for it, and you say, I want to pay out of pocket, you can. But mostly we try to get the right diagnosis, like if you have hypothyroidism and you want to do a TSH, then that would cover it. So long as it's an appropriate lab work, Medicare will cover it.
I do not have a question per se, but I want to let you know that I'm very impressed with what the health clinic can do here. I was aware of some of the things that you do, sort of kind of vaguely aware of some others, and not at all aware of some things. I'm very impressed with what we have here at Westminster. I just want to compliment you and the management of this facility for all the things that you can do for us. And that's about it. Just a general thank you for being here.
Thank you for saying that, and you're very welcome.
Yeah, and just to let you know, our hours are Monday through Friday. We open at 8:30 and we close from 12:30 to 1:30 for lunch, and then we stay open until 5.
Okay, I just want to give you more work. I've been here, 2.5, a little bit more years? Okay, better? I've been here 2.5 years or so, and what I'm noticing now is that I'm really going into a different part of my life. I have been in that different part, staying here. And I thought I wouldn't have any trouble, and I don't think I do. But every once in a while, I think it would be nice to have a group here that could discuss things like that on a regular basis. I think
That's
it would
a
be
good
a healthy
idea.
thing to have.
That's probably a Rachel thing. I'll send her an email.
Does everybody know Rachel Gill? She's the social worker that is available for everybody here. Other questions?
Well, before you all leave after the questions, we have to do the guess who
Yes,
that we forgot about, sort of.
We would like to know what the after-hours number is.
So the after-hours number is if you're on the chronic care management program. So if you're interested in being on that program, all you have to do is have 2 chronic diseases. So that pretty much addresses most people in the building. You can make an appointment and we'll sign you up, go over everything, and then we'll give you this little placard magnet that goes on your fridge and it has a number right on there. And once you're signed up, then you can use that number anytime. Any other questions? Okay, so does anybody have a guess whose hero is Julia Child? Of the 3 of us. Anybody have a guess?
You.
Me?
Yeah.
Any other guesses? Y'all agree with that? It actually was Anne. Okay, so who do y'all think was in a band, me or Lisa? No, that was Lisa. I was the one that used to do triathlons, and I did 3 Olympic triathlons and 4 sprint triathlons, all here in Austin. And I got hit by a car training for my first one, and I almost drowned in Lake Pflugerville. But I still went and finished it. And then I did some more after that, so I don't do them anymore. All right, well, thank you all for coming. I hope we answered all your questions, and if you have any other questions, you can always call the clinic or come by.